South Sudan is one of the countries that continue to face a huge burden of outbreaks. Since 2013, more than 4 million people have been displaced. Out of those, 1.9 million are internally displaced persons, of which up to 85% are estimated to be women and children. In 2017, South Sudan saw the longest-running cholera outbreak in its history, which began in June 2016 and ended in December 2017. Preventable diseases like measles spread unchecked, and cases of Kala-Azar and meningitis are on the rise. Shortages of drugs and skilled professionals mean access to healthcare is increasingly sparse, posing serious environmental health risks that contribute to the grim picture for health in South Sudan. In response to this challenge, the World Health Organization (WHO) has established an emergency program to enhance South Sudan's preparedness and intervention in line with the International Health Regulations (IHR 2005). Part of this initiative is the construction of an emergency operations center, the first of its kind in South Sudan. The facility that took 18 months to construct was funded by the government of Japan and opened in July 2018. The purpose of this one-stop facility being twofold: the development of the Health Ministry's capacity to adequately coordinate preparedness and respond to all public health hazards in the country. Secondly, to act as a reservoir of all outbreak management information, preparedness guidance, and the provision of support to partners in precisely tailoring their interventions to identified areas.
So WHO is much honored to have partnered with the people of Japan to support the Ministry of Health in this key area. And we have noticed that in the 21st century, the management, proper planning, coordination, and response to public health hazards is key in ensuring that we reduce on deaths, but also making sure that we are able to contain outbreaks at the points of source where they started without them spreading to other countries as required under international health regulation. We have all the procedures that have been developed here in the EOC, and then with this facility we can also be able to remotely support the different states that are responding to outbreak, because the facility is equipped with modern audio and video facilities, and we provide them real-time technical support in the areas that they are responding in. And secondly, this facility also is going to enhance the capacity of the Ministry of Health to prepare much better, because when you have an emergency operating center, you are able to track your risks, you are able to monitor your hazards, you can be able to identify areas that are vulnerable and where the capacity is low, and you can build appropriate capacity so that you can be able to better respond. In Yirol, and then also this suspected one in Juba, so that we can have now a comprehensive assessment of the situation and see how we can be able to respond.
Last year they attended the local points training.
Yeah.
And also they have now 2 members.
So I think we should also work with the Juba state to make sure that the team is ready, and then we can have this.
Conflict and economic crisis, destruction of healthcare facilities, and attacks on health workers lead to insecurity, displacement, poor access to services, extremely poor diet in terms of both quality and quantity, limited access to safe drinking water and sanitation facilities, and generally deplorable hygiene practices that are characterized by poor healthcare infections control and hazardous infectious waste management. Disease outbreaks have lasted longer than ever and reached previously unaffected areas, weakening already vulnerable people's ability to cope with multiple shocks.
Procuring and prepositioning of this medical kit is part of WHO's global strategy to better protect 1 billion more people from health emergencies. WHO has been working closely with Ministry of Health and partners to actualize this strategy. Over the last 1 year, WHO has procured and dispatched different categories of these medical emergency kits. We dispatched over 1,000 inter-agency health emergency kits. We also have deployed over 1,000 cholera kits in areas where outbreak of cholera has been going on. Another kind is the severe acute malnutrition kits. We have deployed over 50 of them to stabilization centers where children with medical complications have been admitted. In hospitals which handles trauma cases, we have also deployed trauma kits and also anesthetic kits to be used in theaters. WHO is a co-pipeline lead, and with funding from South Sudan Humanitarian Fund and European Union Humanitarian Aid, WHO procures life-saving supplies to treat these conditions. WHO procures, prepositions, and dispatches these WHO emergency kits as part of general preparedness and response in this country through the health cluster partners, both at national level and at state level. Outbreak investigation kits are also part of these medical kits, WHO medical kits. It is also deployed in areas where suspected outbreaks are followed up in the field, aiming at immediate confirmation of an outbreak so that the response is not unnecessarily delayed and lives are saved.
In South Sudan, WHO and its health partners are providing important leadership and technical support.
We provide tools for surveillance because we know surveillance is data collection, analysis, interpretation, and dispersion. And then this data is collected from health facilities, which are run by staff either of the ministry or of the partners. Once the data is collected, it is analyzed, and then the reports are projected for action by the beneficiaries, who may be the ministry or the partners who are on ground.
May I also take this opportunity to thank our donors, the South Sudan Humanitarian Fund, the European Union Humanitarian Aid, USAID, Gavi, and Government of Japan for their continued support. Many lives of the vulnerable population have been saved through this continued support.